I am Dr. Nityashanti, Professor of Department of Pharmaceutics. I hereby starting my online classes for the benefit of the students in B.Pharm and M.Pharm, especially in pharmaceutics subjects. Also, candidates planning for competitive exams in pharmacy also can benefit from my online classes. I am starting videos on biopharmaceutics and pharmacokinetics subject according to the syllabus framed by PCI. So, the subject indicates two topics. One is biopharmaceutics and another is study of pharmacokinetics. Both are study of the movement of drug in the body. Once you administer the drug in the body, the drug moves like in a fashion A to D to M to E and it gets out of the body. That is, the drug absorbs, distributes, metabolizes and then excretes. That is, movement of drug from site of administration to the systemic circulation is absorption, and from systemic circulation to different cells and body fluids is distribution, and then movement towards liver, kidney and finally got excreted. So the study of movement of drug inside the body deals with the biopharmaceutics and pharmacokinetics. So we move to the topic absorption. So absorption, what is absorption? So again, it is the process of movement of drug from site of administration to systemic circulation. That means the site of administration may be oral, may be ocular, may be topical, may be nasal, vaginal, rectal. Wherever the drug administered, from there the drug movement to blood. So systemic circulation is blood. This movement is known as absorption. So moving on to the different factors affecting the drug absorption, before that you have to study about all the mechanisms of drug absorption. So how the drug absorbs from site of administration to the blood. So what all the mechanisms involved in drug absorption? So mechanism of drug absorption, or it is passage of drugs across biological barrier. So absorption is the movement of drug from site of administration to systemic circulation, that is blood. So we have a barrier in between this. This is known as a biological membrane. This biological membrane may be intestinal membrane, may be skin or any cell membrane, which is made of lipid, protein, lipoproteins, and this has numerous carriers and some aqueous pores in the membrane. So the drug permeates through this mechanism by any of the following mechanism. So what are the different mechanism of drug absorption? So the major mechanism of drug absorption is by passive diffusion, and the second important one is carrier mediated transport, and under that we have active transport and facilitated diffusion. And the third mechanism of drug absorption is vesicular transport, that is by formation of vesicles, either phagocytosis or pinocytosis. And the fourth mechanism is pore transport, and also there is mechanism which is ion pair transport. So there are 5 mechanism of drug absorption: passive diffusion, and second one is carrier mediated transport, under which we have active transport and facilitated diffusion. And the third transport mechanism is vesicular transport, which is phagocytosis and pinocytosis, then pore transport and ion pair transport. So the first mechanism is passive diffusion. So many questions can come in competitive exams regarding passive diffusion and carrier mediated transport. So the passive diffusion, the diffusion, first of all we should know the meaning of diffusion. Diffusion means it is the movement of drug molecules from higher concentration to lower concentration. That is movement from high concentration to low concentration, which is known as downhill transport. That means you are just getting down the hill. The transport of drugs takes place from high concentration to low concentration. That is downhill transport. Moving towards the plains from the hills, through the hills. That is known as downhill transport. So diffusion is the movement of drug from higher concentration to lower concentration. So the law. So once the drug is moving from higher concentration to lower concentration, that there is no energy needed for the transport. So it is also known as passive, means no requirement of any energy or ATP. So passively it moves from different concentration. So the main requirement for passive diffusion is that concentration gradient. That is, there must be two different concentration, C1 and C2, across the biological membrane. The donor, that is the site of administration, should have high concentration, and systemic circulation should have low concentration. So the main driving force for passive diffusion is concentration gradient. So driving force of passive diffusion is concentration gradient, and it depends upon the physicochemical properties of drug. So the drug's lipophilicity and the molecular size. The drug's lipophilicity and the molecular size determines the movement through passive diffusion. So these are the determining factor of drug for passive diffusion. So the law which governs the passive diffusion is Fick's law, which is the rate of absorption is dependent on the concentration gradient, which we explained in the diffusion. So for absorption rate to increase, there must be concentration gradient. In case of passive diffusion, the movement takes place once the concentration gradient occurs. So concentration gradient can be written mathematically as delta C. When you expand this equation, the rate can be written as change in concentration with respect to change in time, equated with a constant, and when you expand this delta C, it will be C1 minus C2, higher concentration initially, minus. So change can be mathematically written as minus, that is change, difference in concentration. So the rate of absorption is proportional, can be equated with the help of one constant. That constant includes other constants like d, a, k, o by w upon h, where d is the diffusivity of the molecule, that is how much the drug molecules diffuse, and a is the area of diffusion, and ko by w is the partition coefficient or the permeability of the membrane, and h is the thickness of the membrane. These are all the constants which explains the property of biological membrane. So these numerator parameters are directly proportional to k, and the denominator h is inversely proportional to k. That means diffusivity, if there will be diffusivity more of the particles or the solute molecules, then the K also will be greater. And same area and the permeability is directly proportional to K. Whereas if there will be a thickness of the membrane is greater, then the rate of diffusion will be less. So this is all about the constants. So C1, that is the high concentration, C1 is very greater than that of C2. Since C2 is the concentration of drug in systemic circulation, that is in blood. Blood's volume is about 6 liter. So the amount of drug when it reaches the 6 liter, it immediately gets diluted and the concentration will reduce and it will be very less concentration in C2. So you can neglect the concentration of C2. So the equation will be further reduced as the rate of absorption, that is dC upon dt, is equal to K into C1, because we just neglected C2 as it is very low concentration. So can you see this equation? It is relating the first order kinetics, that is the rate is directly proportional to concentration. That means passive diffusion follows first order kinetics. What does it mean? It follows first order kinetics means as you increase the concentration of drug, there will be increase in rate of absorption linearly and the intercept will meeting the 0. So as you increase the concentration of drug, the rate of absorption also increases. This is explained by the Fick's first law and this is followed by the passive diffusion. So the passive diffusion follows first order kinetics. So which type of drugs can be passively diffused? So the drug which are highly lipophilic in nature, or the drugs which are small and hydrophilic. Since the drugs which are lipophilic in nature can easily permeate through the lipid membrane, the lipophilic drug can pass easily, whereas hydrophilic drugs cannot pass through the lipid membrane, but the smaller size hydrophilic molecule can pass through the lipid membrane. So passive diffusion can be enhanced in case of highly lipophilic drug and small hydrophilic drugs. So the example for drugs which undergo passive diffusion are highly lipophilic drugs and small hydrophilic molecules. Majority of the drug absorption takes place by this passive diffusion. So in summary, what I have to explain is the passive diffusion is nothing but the movement of drug from higher concentration to lower concentration, which requires no energy, and the driving force for passive diffusion is its concentration gradient, and the factors which are going to affect is the physicochemical property of the drug, that is lipophilicity and the molecular size of the drug. As we said, highly lipophilic and small hydrophilic, that is lipophilicity, highly lipophilic, and depending upon molecular size, if it is hydrophilic, small molecules can pass by passive diffusion, and this can be governed by the law Fick's law, which means Fick's law explains that rate of absorption is directly proportional to concentration gradient. That means absorption takes place by passive diffusion only if there will be high concentration from donor compartment and low concentration in the receptor compartment, that is blood. So the rate can be written mathematically as dC upon dt, that is change in concentration with respect to time. There will be change in concentration as the time changes, is equal to, if you just remove the proportionality, you include a equal to and one constant. So delta C can be expanded as C1 minus C2, and C2 is very less, so we are neglecting this, and the equation is reduced further to dC upon dt dC upon dt is equal to K into C1, which is the first order kinetic rate equation, that is rate is directly proportional to concentration. When you just reduce it, this will become like the rate is proportional to concentration. Rate is dependent on concentration, which can be graphically explained as the concentration increases, the rate of absorption also increases. And the drug examples for passive diffusion are highly lipophilic molecules and small hydrophilic molecules. Now, moving on to the next mechanism, the next most important mechanism is carrier mediated transport. So the carrier mediated transport is just opposite to the passive diffusion. The second important most drug absorption mechanism is carrier mediated transport. So through this carrier mediated transport, nutrients, that is like glucose, amino acids, lipids, and some minerals and some vitamins gets absorbed by this carrier mediated